a serum screening test for the vulnerable patient. I think the CRP provides that. The problem is it doesn't always identify an immediate risk. Some patients have vascular events many years after having an elevated CRP, and one doesn't know what vessel or what organ is at risk. Furthermore, the CRP is elevated by any infection. So if you have a upper respiratory infection from a virus, your CRP might be elevated. That would be a transient phenomenon and not necessarily expected to lead to some adverse vascular event. I hope that we'll have a more specific screening test in time, perhaps something shed from a vulnerable plaque that one would be able to measure that would indicate that one has inflammation and it's progressing and it's dangerous. We don't have that yet, but I hope in time we might. We do know that in patients with unstable angina or non-Q-wave myocardial infarction, that elevations in troponin I, the amyloid A protein, fibrinogen, interleukin-6, and CRP all predict an adverse course in the future. And it's clear at this time that such patients are best treated with some form of interventional procedure, angioplasty, stent, or bypass surgery. So we have some markers, but for the patient not with a unstable syndrome, we don't yet have a marker that would identify their specific risk in the very short term, other than the C-reactive protein.